Hello and welcome to Health Matters on Channels Television. I'm Yomi Otaibe. On the program today, it's all about regenerative medicine. Particularly, we'll be looking into adult stem cell therapy and platelet-rich plasma therapy. Okay, you're thinking already, what's this about? Not to worry, I have with me in the studio a regenerative medicine specialist at Glory Wellness and Regenerative Center in Lagos, Dr. David Ikudaisi. Good to have you on the show.
Thank you for having me.
Okay, I'm sure when I mentioned plasma, adult stem cell, people are wondering, okay, so what's this about? Let's start first. What is regenerative medicine?
Yes, regenerative medicine is a branch of translational research and molecular biology that deals with the process of replacing or regenerating the human cells. And this is being done by stimulating the body's own natural healing mechanism to make it possible to heal and repair things that we always think are irreparable.
So it's about using what the body has to heal the body itself.
That is correct, because that is how God, created us.
Okay.
For example, quickly, if somebody mistakenly cut their skin in the kitchen while making food or something, within 3 days or so, the skin will start closing up and healing. Now, regenerative medicine has a way to use the same thing that God has given us to heal, but in a faster, accelerated way.
Okay, now let's start with adult stem cell therapy. What's that about?
Well, adult stem cell therapy is one of the three types of stem cell therapy. The word adult is not about age. It's because the three types of adult stem cell therapy includes using the bone marrow from the same patient, using the fat from the patient's stomach area, or using the umbilical cord stem cells from a newly born baby cord and cord blood. That is why I said adult is not about age, but it is about matured human being.
Okay.
Because there are also other two types of stem cell.
Which are?
The embryonic stem cells,
That's controversial.
Yes. That's the one everybody think about when they hear the word stem cell. The embryonic stem cell is when stem cells are being harvested from things like, let me say, a fertilized egg at the age of day 5 to 14. And you can get this from IVF clinics. That's where the researchers get the donation from. People think these are potential human beings, so why mess with it?
They are.
Yes, it is true. They are.
Yeah.
So that is why it has the religious, controversial issue. It is unethical, and most countries, including US, does not allow it, in the mainstream. And the third group of stem cell is iPSC. The iPSC is induced pluripotent stem cells. That's when you take any adult somatic cells to the lab, reprogram it to now behave like the embryonic. You didn't get it from IVF clinic, but you are making it to behave like the embryonic.
Okay.
So those two, they have the disadvantage that they can keep growing unlimited, which can lead to cancer. So far we've not been able to tame the limit of their growth. Whereas adult stem cell therapy has the disadvantage of limited growth. But that disadvantage is what becomes a plus that allows us to use it in the clinic.
Okay, you've mentioned, we have a picture showing on the screen right now, I think some parts of the body where the cells can be taken from. You mentioned the stomach. Yeah. Which other areas?
Okay, like what people are seeing on the screen right now, the somatic stem cells in the body. It shows that we have, you can harvest stem cells from the heart, from the blood, from even the tooth, and the skin, the bone marrow, the fat, like I mentioned earlier. But for adult stem cell therapy, the one that is currently being done or allowed in US, is a process whereby you harvest the stem cell, on the same day and give it back to the patient the same day. Like, let's say the patient comes in the morning, you do liposuction to get the fat, or you do bone marrow aspiration to get the bone marrow. Then you turn around and you process it, get your stem cell from those sources and deliver it to where you need it in that patient.
Okay,
that same day.
That same day?
Yes.
Okay. Now tell us, who are those who perhaps would need this adult stem cells therapy? Okay.
The list is very, very broad, but the simple way to understand it would be if there is degeneration in any part of the body, if there is need for repair, adult stem cell therapy may help that patient. The exceptions are HIV patients and cancer patients.
Why?
That being said, we cannot use it to cure cancer the way it has been done, adult stem cell therapy. You take it and you deliver it back to the patient. Although those patients improved, the studies show that the cancers get shrunk, but you can, the patient will eventually die, but you are prolonging their life, making their life better. So we don't really want to push it as a recommendation. The way the way stem cell is playing a role in cancer is still in research stage, whereby the patient's cells are being taken to the lab. That's what they're talking about, the somatic cells that people saw on the screen. And then the iPSC, induced pluripotent stem cells, are being made, and those somatic cells are being targeted to particular maybe cancer and given back to the patient to attack that cancer. That's in research stage, but that's not been done the same day. So that the adult stem cell therapy is the same day treatment. And you can't achieve that treating cancer that way, but you can use it to tone down the inflammation. You can do modulation with the patient so they do better.
Okay, the plasma, platelet-rich plasma. Yes. Tell us about that.
And that one is kind of simpler. It's simpler than adult stem cell therapy. Patients just go to the doctor's office, have their blood drawn as if they're going to do a blood test.
Like we have it on the screen right now?
There you go.
Okay.
And then the blood is now being put into a certain machine at certain program gravitational force and time, and it's been processed to separate that blood into plasma, which is the yellow part on top, on the left side on the screen, and the red part is the red blood cells, which is not needed. And that top part that is yellow, which is the plasma, a section of it is very rich in platelets. That is where the name platelet-rich plasma comes from. Okay. And the platelets is what goes into action. They contain granules, alpha granules, growth factors, cytokines, that when you activate it, they go into action and start stimulating the repair and regeneration of that tissue or organ where you inject it.
Okay. So for this, I can see this, you take the blood.
Yes.
And then I guess that represents the number 2, represents like the machine that will spin it around to separate the red blood cells from the platelets, and then the person gets to use it wherever it's needed. So tell us, I know you have a story about yourself. Maybe we should start from you. You had some kind of therapy too. Tell us about that.
Yes, I use the platelet-rich plasma therapy, or PRP, to do hair loss restoration for myself.
Okay, there we have you.